Welcome. Welcome to the clinic. Please sit down, please.
Thank you.
All right. So first, my name is Christian Romero. I'm gonna be your provider for today. Before we can begin, I'm gonna be recording this video for academic purposes. My faculty or professor can use it as education purposes. Do you agree to be part of this?
Yes, I consent for this video to be used for academic purposes.
All right. So what's the reason that you came to the clinic?
For an annual checkup?
Alright. So I'm gonna be starting with a couple of questions, okay? Mainly, I want to know about your medical history, your family history, to see if there's any risk factors that could develop in the future, okay? So first, what's your medical history? Do you have any problems?
No. No.
Any surgical interventions that could have happened?
I had my gallbladder removed last October.
Okay, and were you hospitalized
Yes.
at that point? Okay, so 2018,
Mm-hmm.
right? Around what month?
October?
October. Okay. What about your family? Do you live with your parents? Are you
I
married?
live with my husband and my two daughters.
Okay. What's your occupation?
I'm a teacher.
A teacher. Oh, great. Congratulations.
Thank you.
Um, your mother, does she have any problems medically wise?
My mom has diabetes.
Okay. What about your father?
Diabetes as well. And my mom also has hypertension.
Okay. And your sibling? Do you have any siblings?
Two siblings.
Okay. And any problems with them?
No.
So I'm gonna be expanding or more precise on your mother's side, maternal side. Your grandfather had any problems?
No, just no diabetes as well.
And what about your grandmother?
Same thing.
Same thing.
Mhm.
And your paternal side, any problems with grandfather or grandmother?
No.
All right. Um, have you lost any weight recently? Any weight changes that you noticed?
No. Everything's the same.
Okay. Any fevers?
No.
Any loss of appetite?
No.
Um, yeah. What about allergies? Do you have any allergies with medications?
No.
No allergies with medications. Food.
No.
What about latex?
No.
Okay. What's your? You know anything about your immunizations?
You're probably up to date. Since I work with children, I need to have them up to date, so they're just
Okay. What about your flu vaccine? Have you received it last year?
yes.
Okay. Just make sure to also receive it at the end of October. That's when they start giving vaccines again.
Okay.
Do you take any medications or like for example over the counter like for pain,
Ibuprofen,
ibuprofen? Do you know by any chance?
600.
Okay. Is it like every 2 to 3 days, 3 times a day, or as needed?
Just as needed.
Okay. Just make sure that whenever you're taking the ibuprofen, it's what we call an NSAID, so it irritates the stomach very much. So make sure to take the medication with food.
Oh, okay.
Okay. Let's talk about your diet. You usually eat like fast food, uh,
Yes.
a lot of fast food,
Yes.
so a lot of fats, right?
Yes.
Like hamburgers, like how many times a week, for example,
Hamburgers,
or like
Fast
fast food.
like 2 times a week, 2 or 3.
Okay. Just make sure that since you got the gallbladder removed, sometimes if you eat a lot of fats, your bowel movements will kind of like be more loose. All right. Do you do any exercise?
Not really. I stay active because I'm a teacher and I walk around, but not exercise.
Okay. And you said there's no weight changes or.
No.
Okay. Do you have any religion?
Catholic?
Okay. Um, at home, or do you smoke?
No.
Are you exposed to secondhand smoke?
No.
Any alcohol?
No.
Any drugs?
No.
Um, so you said you had no problems with weight changes And you said no fevers, nothing like that.
No.
Have you had any problems with your eyes, for example?
No. Nothing.
No, any redness, any discharge? Do you use glasses?
No. Nothing.
Okay. What about your nose? Are you congested? Can you breathe well?
Yes.
Ears? Any loss of balance? Any earache?
No.
No. Any discharge? Any pus? Nothing.
No.
Your mouth? Any recent dental procedures that could have happened recently?
No.
Okay. Any bleeding around
No.
when you
Nothing.
brush your teeth? Nothing.
No.
And in your neck? Any problems when you move it?
No.
Any stiffness?
No.
Can you swallow food fine?
Yes.
Okay. Um, so cardiovascular, your heart, any palpitations recently? Any chest pain, shortness
No.
of breath? Nothing.
Mhm.
Okay. What about your lungs? Any problems with like cough, sputum or phlegm, anything like that?
No.
Have you ever been exposed to tuberculosis?
No.
Okay. Your bowels. Are you having good bowel movements?
Yes.
Are they soft or are you usually constipated?
Soft.
Soft. And you have bowel movements every day or?
Yes, every day.
Every day. Okay. No bleeding.
No.
Nothing. Brown color.
Yes.
And when you urinate, is it painful?
No.
Do you urinate a lot?
I guess the normal amount.
Okay. Does it smell when you urinate? Like strong, like
No.
foul smell?
No.
Okay. Usually it's normal when, like for example, whenever you wake up and you urinate the first time, it's gonna be the strongest of all the day. So based on females, you have to be very cautious because sometimes they're more prone to develop urinary tract infection because urinary tracts are shorter. So it's important for you to have good perineal hygiene, so clean from up and down. Okay. And if in any case you have any pain upon urination or lower abdominal pain, please come to the clinic so we can do some tests. Okay.
Okay.
Menstrual period. Are you usually regular?
Yes, I'm regular.
When was the last time you had a menstrual period?
Last week.
Last week. Okay. If any chances is there any possibility that you're pregnant at this
No.
time? Okay. What type of contraception do you use?
Condoms.
Okay. Any problems with your muscles? For example, can you raise your arms, legs, and everything? There's
Everything.
no decreased strength,
No.
more weakness on one side or the other.
No.
Okay. Any skin issues? Any like skin lumps? Any rashes? Any cuts? Or like vesicles or anything abnormal in your
No.
skin? Okay. Have you ever had any thought of suicide?
No.
Any signs of depression, anxiety? Do you bruise easily or no?
Yes.
Okay, you bruise easily. Have they ever do any tests like blood work?
They just did one about 2 weeks ago.
And was it normal?
Yes.
Okay. No anemia.
No.
Um, are you intolerant to any heat or cold that you know of?
No.
Any questions that you might have?
Not that I can think of right now.
Okay, so based on your family history, because I mean you're relatively very your health is very well maintained, so it's important to prevent any conditions that your family have, because that's gonna develop like risk factors for you to develop. So right now it's doing a lot of exercise, about like 90 minutes or 120 minutes a week, like moderate to fast conditioning, especially to maintain your well-being or your optimal health. Also, low fats, as I mentioned, since you had the gallbladder removed, it's really important to maintain low fats because then your bowel movements are gonna be more loose, and then you're gonna suffer the consequences. Um, for diabetes. You told me that your family had history of diabetes, so low sugars, okay, um, and maintaining the weight. Okay, if you have any problems or anything that arise, you can give me a call. Um, but like I said, this is like the annual checkup is mainly to prevent anything from going on. Okay, alrighty. And any questions, anything like that?
No, not right now.
All right. Well, thank you very much and have a great day.
Thank you. You too.